Alors bonjour tout le monde.
So hello everyone and welcome to this press conference from the Minister of Higher Education, Ms. Danielle McCann, who is together with Dr. Richard Massé, who is the Public Health Strategic Medical Advisor. After the Minister's announcement, there will be a question period in both French and English.
Commencez à vous la parole, Madame McCann.
Ms. McCann. Thank you. So hello everyone. So I first want to salute Dr. Richard Massé here by my side. As you know, the epidemiological situation is evolving quickly, and we're looking for constant balance between the protection of physical health and maintaining good mental health of the student public as well as academic learning. For months now, I have been talking together with public health in order to get some easing of the measures in higher education establishments in red zones. So I wish to thank Public Health for their opening. My team and myself, we are in regular contact with the representatives of students, whether it be at the college level as well as the university level. I hear that although for some remote learning is going not so badly, for others it's a great deal more difficult. They feel alone, they feel isolated, and I am very worried by this. Higher learning is a very important step for many of our young people. The needs for socialization and belonging are one of the keys to success. And so I wish to salute the efforts of the students in the past months. They have been patient and understanding, and they have continued with their projects of studying. I also wish to thank our teachers, our professors, and our establishments who have been able to adapt themselves quickly throughout the last year. The public collegial network, as well as the university sectors, at the fall, had no significant increase of dropouts compared to other years, and that is remarkable. So, to all those students, I wish to reiterate and say bravo. Today, we are announcing a series of adjustments as well as easings of measures in order to allow students to be able to study on campuses more. As of the 8th of February, in higher learning establishments in red zones, in agreement with public health, colleges and universities are going to be authorized to offer gradually theoretical courses on campus as long as students keep a 1.5 meter distance between themselves when they are sitting in class, that the occupancy rate of classrooms does not go beyond 50%, that the continuity of teaching activities that is offered remotely right now be ensured for the members of the student community who cannot or do not wish to go directly on the campus. As well, group activities for teaching purposes with a maximum of 6 students will be allowed while respecting the 2-meter distance between people in order, for example, do teamwork, follow a class remotely in a room with classroom colleagues, allow for group study. When they are in a building or a local that is occupied by a higher learning establishment in red or orange zones, the members of the student community will have to wear a procedural mask at all times, except during certain exceptions. Everywhere, health guidelines will have to continue being rigorously applied. Libraries remain opened, but circulation and how many will be controlled, as well as how many people can go there. Student services will be offered in person as well as remotely according to the needs of the students and while respecting the health guidelines and by appointment. Each establishment is going to have to set up surveillance and control systems for circulation in order to avoid the creation of any problems with too many people, particularly when coming in or out of buildings. All establishments have to make sure that students who wish to have the possibility of being present on the campus many times per month, ideally once per week, in order to be able to take advantage of group activities with a teaching purpose and others. What we want here is to break isolation because many students say that they're suffering from this. So we believe that this step is a first step towards a safe and progressive return to campuses. It will be primordial to respect the health guidelines because we do not want to have to tighten the rules anew. So I avoid all higher learning establishments to continue with the rigorous work as far as the control of the application of the health guidelines are concerned, amongst others, by ensuring an accrued surveillance of all activities and services that will take place in person. Those new measures will contribute, and I'm sure of it, to offer a student experience that will be more stimulating and more harmonious for everyone. The students of Quebec have shown a very great capacity to adapt since the beginning of the pandemic. And so I ask you once again, to maintain their efforts and to respect the health guidelines. That is what will allow us to maintain our campuses open. Thank you.
Alors, on va passer maintenant à la période des questions. Je demande...
We will now start with the question period.
Je vais commencer avec les questions des journalistes qui sont en présentiel. Madame Moras de la presse.
Oui, bonjour à tous les deux. Les sessions sont déjà bien
The sessions have already started in both CEGEPS and universities. Will there be help offered to professors and teachers to adapt their classes so that they be at once in person and remote? Thank you for asking that question because first, right off the bat, I want to say to all professors that I recognize that this is a considerable effort that we're asking of them. Of course, we're going to be there to offer support. We've already given financial support to establishments and have done so since the beginning of the pandemic, $215 million so far for material support, teaching support. That means that we've already added professors and also other support to help. And now, of course, we're asking for further adjustment. And if ever they have additional needs, we are there. We will be listening to you, and we'll see what we can do to help. So we will be side by side as of now and the 8th of February because we are in contact with them regularly. And we have had meetings in the past few days. And I believe that they are very positive with this news, and I salute them for this as well because I do know that it's considerable effort, but they are also very concerned by the mental health and the academic success of their students. So we will be there if they have any additional needs. We'll take good note of it and we'll help them. As a follow-up, the Premier said so a couple of days ago, professors, teachers at universities and CEGEPS, these are autonomous entities. How can you make sure that this return once a week will be done for most students? Well, of course, we are going to continue being in link with them very closely. We have very significant links with them, and we'll continue. We will be there for them. They are, in fact, autonomous, but as I was saying previously, we know very well that they are very concerned with the mental health and the academic success of their students. So we expect that they will deploy all the efforts for this. But we will ask for news and information to see whether there's any obstacles and what we can do to help them. So we expect that all CEGEPS and all universities will really help out. For some, it will probably be more difficult. There are some establishments in certain regions of Quebec that have gone further in terms of presence on campuses during the pandemic in the fall. But there are others, like, for example, establishments in Montreal where it's more difficult because, say, of the architecture. So we are there to help them. And we're going to have to be an establishment and we're going to have to show creativity and perhaps to have innovative solutions. But even as I speak of Montreal, there have been at least 20 to 30% of students who have been able to go on the campuses last fall. So I think that establishments have already developed know-how that is going to truly allow them to be able to give this training in presence to the students. But if you'll allow me, it's not a return to normality. It's not a presence on campuses like we've seen before. It's a first step. And I believe that we absolutely have to make sure that students realize that it will be very gradual, that, for example, there are establishments that will be able to open more on the 8th of February, as of the 8th of February, but there are others where they're going to need more time for all sorts of reasons. But we're going to be keeping a very close eye on that, and we expect that all establishments will be able to offer students the possibility of being present many times in the month, at least once a week, whether it be for classes or whether it be for team activities in teams of 6, so that our students be able to have contacts with colleagues, but also with professors. This is fundamental.
On va maintenant aller à distance. La question de Geneviève Lajoie du Journal de Québec.
Oui, bonjour, m'entendez-vous?
Oui.
Can you hear me? Yes.
Oui, bonjour, Madame McCann, m'entendez-vous bien?
Oui, bonjour, Madame Lajoie.
Écoutez, je voulais vous parler
I wanted to talk to you a little bit about this binary way of doing this. So teaching that is going to be half in class, half remotely, or at the same time in both class format and remotely. And you're saying that students' presence will not be mandatory, so the students will have the choice. But what about professors? We understand that teachers will be forced to offer the classes both in presence and remotely. What has to be understood is that there are professors and teachers that may have reasons that make it that they cannot go on the campus. It can be health reasons, for example, and we know that people who are 70 and over can have exemptions, and people who have chronic illnesses as well. So we'll take that on a case-by-case scenario. Each establishment has to have conversations with that professor in question. But otherwise, the health guidelines that we're applying, of course, for the students are also applicable for the staff. So wearing a mask, physical distancing as well. So all the measures will be taken in order to truly make it so that the context be safe. So it is a case-by-case scenario, but normally, if there are no reasons for the professor to be excluded that are, in the reasons given by the CNSST, they should go on the campus. Of course, if truly they are part, if they are part of the teachers that give classes that will be given in presence. Isn't it just a little too late in certain cases, since there's a lot of young people who go to CEGEPS and universities, and they come from further away regions? In certain cases, they went back to those places because they didn't have any classes in person, so they went back home and they're now following their classes remotely. Isn't it a little too late to propose this to them? Well, for those students, we can understand that this is a specific situation, and some probably will want to come back to the campus, but some won't be able to, and we understand that, in fact, that it can happen. And, that's why you were mentioning the two-modal teaching. When you're saying, isn't it a little too late? Well, listen, I think that taking into account, and it's my expression right now to describe the situation, but the pandemic does not care about the calendar year or the school year. We had a peak in terms of transmission in January as far as the virus of transmission is concerned. So in November and December, when we saw that the transmission was increasing, we could not open further. Public health was not able to give us that orientation because of the pandemic situation. Now, we can see that there is an improvement, so we have to seize that opportunity, and I believe that we are going to do the most that can be done. It's true that it's not ideal because the session has already started, but in my opinion, there's still the possibility of doing so and to offer a minimum of presence. We're talking here about a minimum, but that is going to, I think, do our students a lot of good. We've had meetings with the representatives of student associations, and they are very happy with this news, as establishments are as well.
Prochaine question, Olivier Bossé du Soleil.
Bonjour.
Bonjour.
Première chose, Madame McCann.
First thing, Ms. McCann, will that also be the case for establishments in orange zones? So will it still be 50% and groups of 6 max? No, in orange zones, we're talking about the same rules that were applicable in the fall. That is to say, there's a lot more flexibility. What we're saying basically, establishments in orange zones, and we know what the 6 regions are, that those establishments may give a maximum of classes in presence, in person, but while respecting the distancing rules, which is 1.5 meters of distance and 2 meters when you're not sitting in a classroom, and particularly to wear a procedural mask in all situations, except, for example, if you're eating or if you're taking a singing class, very exceptional situations such as that one. So for establishments in orange zones, it is the same thing, the same guidelines as in the fall, when there were orange zones before everything went back into lockdown. What we're adding here, which is a very important one, is the procedural mask at all times, even while sitting in a classroom. So what I would like to add, if you allow me, is to say to students who are listening to us, we are counting on you because we could imagine that when students arrive on the campus and they won't have seen their friends, their colleagues for a long time, that there will be a feeling of getting back together again, and that can be reflexes. So help one another out, show solidarity, and keep that 2-meter distance. So we're counting on you. In the past, there were no outbreaks on campuses. We know that there were lab activities, research activities going on. People went to the library, and there were no outbreaks. There were a couple of exceptions in residences, but otherwise there were none. So students, in my opinion, are very responsible, and they are going to be able to follow the health guidelines while being very conscious, of course, that things are not back to normal, obviously. My further question is on the 50%. Who's going to be deciding that? Is it going to be a selection? Is the professor going to draw straws? Well, I think it will be the establishments and professors who will choose. They will talk about it amongst themselves. The professors are very important in terms of that decision. They are the ones that can really give the correct information to the teams. So I think that it will be done locally. It's the best way to do so. I have a specific concern for first-year students, particularly in CEGEPS, because they didn't have their last session at high school, and they've experienced many months of remote learning. So first-year CEGEP students, very important to give specific attention to those students. Also, students who have a handicap, to give specific attention to them, as well as those students who are having difficulties in terms of internet connection or who cannot be comfortably isolated to be able to study. So those students are a priority. I'm also thinking about pre-university students at CEGEP who probably had no contacts with the campus because they don't have any labs. So I'm thinking that some good decisions are going to be made locally on this basis by establishments and professors.
Merci, M. Bossé. La prochaine question, Pierre Saint-Arnaud de la presse canadienne.
Bonjour, Mme McCann, vous m'entendez?
Oui, oui, M. Saint-Arnaud. Bonjour.
Deux questions pour vous. La première...
Two questions. The first one has to do with the evaluation. Are we making an evaluation or seeing the evaluation of learning, the learning that has been made since the beginning of the pandemic as compared to what existed before the pandemic? What I mean to say with my question is, are we measuring the impact of the distancing measures on the quality of the teaching? That is a very important question that you're asking. One of the first things that I can tell you is that we've really been keeping a close eye on the registration rate as well as the success rate of our students. So the good news is that the success rate has not been impacted. The dropout rate has remained the same this year as compared to last year. And we've seen an increase of incomplete rates. We saw that in our data, but that's normal because when we ask, we broaden the rules. Before, it used to be a lot tighter. You couldn't have incomplete, for example, if you didn't have a ticket or a note from the doctor. So we've given more latitudes to be able to hand in an incomplete. And students have used it in certain circumstances that make it that they can go back and take a class, but it's not, they didn't fail. So we've given that opportunity to students. So to summarize, the dropout rate has not increased. We even have a registration rate that has increased this winter. We have more students who registered this winter, so that is good news. As far as the quality of the training is concerned from an educational point of view, that is a fundamental question that we talk about often. Professors have done the utmost in what we call techno-teaching, so teaching with technology, but we really have to look at this more in depth to see how we can continue to improve this training, because remote training will never be the majority in our network, but we will probably be able to use it for a part of classes and a part of that teaching. So we have to make sure that quality is there. But I repeat, professors at CEGEP and universities have really done the utmost, and I believe that the quality is there. But we're going to want to continue improving it in remote teaching because it's there to stay in certain cases, and could it even improve accessibility to studies in others. My question was to know whether you have set up tools to evaluate that quality or not. And my second question, you have probably seen a story of a professor who was dead and had taught, and everything that was done remotely, that is also a problem now. And I know that it is creating concerns, for having talked about it with people, that universities are storing up classes given by professors to be able to use them without having to pay professors. That kind of situation where students cannot have contact with the professors because either they're no longer employed, but their classes are still there and being used. What is the approach of the government at the Ministry of Education faced with that possibility? Well, I'm going to answer your first question and come back to the second one. So for the previous question, the Higher Learning Council, which is an organization that talks of these questions of quality of teaching, we started having discussions with the Superior Council, and we're certainly going to want to start doing work in order to evaluate the quality of remote teaching. So that's how I'd like to complete my previous answer. As far as what happened, what you mentioned, well, first, I hope that it is an absolutely exceptional situation, that something like that can have taken place in our universities. I do believe it is. And I cannot prevent myself from saying to what extent, and this is a principle that is shown, that one of the keys to success for our students is the contact that they have with professors. So you can, take some training that had been recorded and put it on the site, and students have access to it to be able to review it, etc. But a period where there's contact with the professor has to be present, and it has to be substantial. That is one of the keys to success and academic success for students. Otherwise, we have synchron training, what we call, that is that the professor is in front of their students and there's exchanges, and that is an extremely interesting formula. But the contact with professors is absolutely essential. That is how we can learn, and I think that the incident that you're talking about, I hope, was exceptional in nature, and what we have to make sure of is that the training that is given not in a synchronized way, that there's always a period of question or a period of time that is kept aside for exchanges with professors and students.
On va passer à Olivier Demers de L'Exilé, qui est le journal étudiant du CEGEPS du Vieux-Montréal.
Oui, bonjour, est-ce que vous m'entendez?
Can you hear me?
Oui, bonjour.
Yes.
Oui, bonjour. Ma question, Madame McCann,
My
c'est
question, Ms. McCann,
comment,
is,
je vais revenir à la question aussi de M. Bossé de tout à l'heure.
and I'm going to piggyback off Mr. Bosse's question. You say you want to give a priority to those students, the first-year students who didn't experience a normal session. How will the ministry make sure of that? Because I can tell you that I've already heard that some students have not had any courses in presence before the red zone, so they've had no social contacts. But how can the ministry make sure that those students will not be forgotten? Well, yes, absolutely. As I was saying previously, we are in almost daily contact with establishments. They are very aware because we've had exchanges with them, and they're very sensitive to that situation. I think that they themselves see that they have to be prioritized. This is not just the Ministry of Higher Learning and Higher Education. It comes from the establishments. We have to prioritize those students who have had no contacts, most particularly in the first year, because they started their CEGEP with no contact since the very beginning. So I believe that sensitivity to that situation is very clear on the part of establishments. And we are also going to make sure that really those establishments have the means to be able to have that link with the students. And that's the role of the ministry. And of course, we're going to be asking for information and making sure that it is done in every establishment. As a follow-up, does the ministry have a plan to help out, for example, the strategy of bringing back class in case that strategy does not work? Will the ministry just take a step back, or will find a solution? I don't know if it's clear, but is there an emergency protocol in case it doesn't work? Well, I think that we are first going to see how things are evolving gradually. And we also know our establishments. We know, in light of what happened in the fall as well, that in red zones, whether it be in red zones or orange zones, we know the establishments. We know what they've done and what they did in the fall. So there are establishments for which we are pretty reassured that they are going to be going forward, perhaps not exactly on the 8th of February, but in a gradual manner. For others, we believe that they will encounter more difficulties and will probably have to pay specific attention to those establishments in order to be able to support them. So I think that the good news here is that there will be presence on the campus at least once a week, ideally for all students. And I think that we have to keep that plan in mind. We have to put all the conditions in place for it to work, and I trust that it will. But I'm telling you right away, it won't be on the 8th of February. It will start, and it will be gradual, and it will deploy throughout Quebec, and we'll be keeping a very close eye on all of it.
Vous m'entendez?
Oui, bonjour.
Bonjour, merci. Je suis allée faire un petit tour ce matin.
I went to the Sainte-Foy CEGEP this morning, and I have to say that it's pretty unanimous. All the young people, the students with whom I talked to me about mental health and the difficulty of staying motivated. So we know that it's not going to be a 100% return. Once a week is not very much. There was money given by your government, but we're told that there's no people don't feel that it has led to more resources. How are you going to make sure that there's that they've added psychologists, for example, people to give support to the students? How are we going to make sure that it is present when they go back to class? Well, it would have to be there as of now. We have given $20 million in mental health to add resources as a psychological support to students, whether it be psychologists, but other kinds of jobs as well. And from what I hear in the field is that resources have been added, and we've asked for accountability on that. And yes, there have been resources added, but there can be places where more time might be required. The other point that I would like to make, and our establishments are very conscious of that, we have to find a means of being able to come into contact with our students. In some places, students simply don't know where to address themselves. So that will be a fundamental aspect, whether it be for psychological health problems. Students have to know where to turn. And I would say that if ever there is a situation that requires immediate attention, or attention that can't be found, there's you can call 811 as well, and there people will be helped to find the resource that will help. So I think that we've taken steps in mental health. We're going to continue working on that front. We are elaborating a mental health action plan for all higher education establishments together with students and establishments, and we are going to have a clear plan as of next spring. As a follow-up, if possible, you were talking about that Superior Council to evaluate the quality of remote teaching. I've spoken to a lot of parents of young people in high schools that were asking for the admissibility criteria to be lowered for next year, because we've seen that about 30%, there's about 30% of fail rate. Some people who had to do math and physics remotely, it was more difficult. Could we review the admissibility criteria for CEGEPS for next year? Well, we are in absolutely exceptional circumstances, and you know that my colleague, Minister Roberge, is working very hard to increase the success rate, but we've never experienced what we are experiencing, and it has had effects. We can't deny it. So what I can tell you is that the key word that we have right now is flexibility. So in terms of admissibility to CEGEPS, there will be flexibility, for example, for university as well. So registration at university establishments are telling us, well, listen, we are going to show flexibility, and we are going to take into account the circumstances that are exceptional that we've just experienced. And there will be. I know that on the education front, Minister Roberge, there's actions being taken to really increase the success rate as well as learning. But it remains that we will show flexibility as far as CEGEPS are concerned.
Prochaine question, Valérie Michaela Bain de Radio-Canada.
Oui, bonjour Madame la Ministre.
Oui, bonjour.
So the opposition has raised a question about using rapid testing. Are you planning on setting up those kinds of measures in order to maximize, let's say, the chances of catching any non-declared cases on campus? I'm going to let Dr. Massé answer that question. If there are outbreaks taking place on a campus or in a group of students, there will be the use of tests, if it can be PCR tests, but in certain circumstances, it could also be rapid tests. That being said, your question is more whether we'll use it in people who are asymptomatic to see whether there is any transmission in those groups. The answer is there are pilot studies that were conducted and that we're following, but we're not going to be doing it regularly, because when those tests are used right now, for each person that is identified, we miss one, and we identify one wrongly as well. So it depends on the tests that we use. I'm not going to go into details of each one of the tests, but when we use those kinds of tests, that is what the result ends up being. So we don't think that it's a good use of the test, and it's not an insurance that we're going to limit transmission by using them either in people who are asymptomatic. So that is probably the question that you wanted to know. But certainly in the case of transmission in a group, whether it be at a college or a university or high school, we will be using them under certain circumstances, but we do generally prefer, when we can, to use PCR traditional tests. Now, we have results within 24 hours, so the delay is relatively short, but there are circumstances where we can use it, yes. Madam Minister, it's obvious that there's a risk of a case, where the students might have a class at 8 and then their 10 o'clock class is supposed to be done remotely, which is going to create more traffic on the campus. What guidelines have you given to establishments? Does that not complicate the logistics of having so many students on the campus? Well, of course, it will be a lot of logistic work, but each establishment will be able to really organize the services to students, the classes to students in the best way possible while respecting health guidelines. There will also be the possibility of having classrooms where students can follow their classes remotely on the campus, up to 6 people. We've said that we were authorizing this, but in terms of schedules, that kind of situation will have to be planned for. So we'll let establishments truly organize everything in the best way possible, because now we really are entering into very, very specific kinds of organizations with schedules in each establishment. So we're going to have to find a formula where we'll be able to keep the measures of 2-meter distancing on campuses, or 1.5 meters in each classroom. And that is the very basis. And the schedules will have to be organized to be able to comply to it.
Merci, Madame Ben. S'il n'y a pas d'autres questions, j'ai Madame Bendali de Radio-Canada en question en français. Dernière question en français.
Last question in French now.
Oui, bonjour, est-ce que vous m'entendez?
Oui?
Monsieur.
Oui, bonjour, je me demandais qu'est-ce qui se passe.
I was wondering what it would happen in the case of an outbreak in a classroom.
On demande aux gens au reste de l'établissement.
Will people in the rest of the establishment have to go back remotely? I will let Dr. Massé answer that question. There are a lot of things that have to be evaluated. Is it one person, or is it an outbreak linked to presence in a classroom? Taking into account that in a red zone, the presence in the classroom is going to be very limited, we believe that that kind of circumstance is going to be relatively controlled and shouldn't happen often. But there's always an investigation when there's an outbreak. So in the case where there's a few transmissions with people in the same classroom, we'll make an investigation, and of course, those people will absolutely be quarantined for close contacts, of course, in order to avoid transmission to others. But if people respect the distancing and wear the mask, those situations should be extremely rare. There were none in the fall. But be assured that we will intervene immediately when it happens, so that any close contact be isolated and respect the quarantine until the end of the transmission period.
Merci.
On va maintenant passer aux questions en anglais. Je vais commencer.
English questions now.
Courriel. Alors, Dr. Massé, vous m'excuserez mon anglais. C'est Kathleen Thomas de la Gazette qui pose la question. What are the risks that come with reopening CEGEPS and universities in terms of the pandemic?
Well, the experience that we had last fall is that there's been no outbreaks in college and university except for people that were living in residencies, and there's been one related with sports event. But related to the people in classes, we haven't seen that first. Second, the measures that are put forward right now with keeping distanciation, the distance between people, and the surgical mask that is now mandatory for all students and teachers also, and the respect of all the other measures will reduce significantly the risk of any event. As we've said before, the risks are often related with prior to classes or after classes event, and people then want to meet and see their friends, and it's normal, but those are things that we must resist, because those are the events where people will transmit, because they kind of let go the barriers, and they don't protect themselves as much. So the risk of having those events during classes is very limited. We have to be very careful before and afterward in all parascholar activities.
Prochaine question en anglais. Lauren McCallum, CBC News.
Hello, you can hear me?
Yes?
Great, okay. All right, I'll start with you, Minister McCann. First of all, you've said it, and we've heard it before, that CEGEPS and universities are independent entities. How can the government force them to reopen if they're comfortable keeping status quo right now?
Well, I'll answer you by saying that they're very concerned about their students, and they're very concerned about the mental health of students and also their success in their studies. they are at the forefront, the organizations, and they're happy about the announcement that we're making today. So the important is that they be able to implement the measures that we're talking about. But I think the will is there. They know very well that it's fundamental that their students have contact minimally on the campus to succeed and to be in a better mental health. So I have confidence that gradually, starting February 8th, they will all advance and open up the teaching in presence at a different rhythm, depending of the CEGEP or university, depending of the region. And we know the organizations, we know that some will have probably a bit more difficulty, notably because they have different quarters, more restricted quarters. So we think that everybody has to be creative. It's a big logistic, but we will be there to support them, and we will follow what's going on with what's going to happen in the next days, and we will be of help if ever they need something to help them advance and go forward and give this opportunity to the students.
Okay, just a little clarification, then I have my second question. The little clarification is, can you force them to open?
Well, you know, they are autonomous, but is it necessary to force them? I don't think so. I think that in the exchange we've had with them, they're all very happy that this is happening, and they want to do everything they can to give presence on their campus. So I don't think it's necessary to force them. They know what's going on. We have des sondages. We've had results. I mean, a big number of students have anxiety, problems with motivation. So, of course, the teachers and the establishments recognize that need. And I think they will go forward, and we will be with them, accompanying them to open up. And if there are some that have more difficulties, we'll find ways to help them.
La prochaine question, Raquel Fletcher de Global News.
Good afternoon. My first question is for Minister McCann. You mentioned that you want to be able to evaluate the quality of online learning, and then you're moving towards that. Can you explain how you're going to do that and what your main preoccupations are? Are you concerned that the online learning that students are getting right now is inadequate?
Could you repeat, sorry, your question, because I missed the beginning of it.
About evaluating the quality of online learning. Are you concerned that in some cases, I guess it's inadequate right now, and also how will you go about evaluating the level of education that across the board, I guess, is what I'm trying to ask.
Well, thank you. Thank you for repeating it. Well, it's as I said before, it's a very important question, and we have no choice but to evaluate online learning, because I think it's there to stay, not in the same quantity as what we see now, because, you know, we're faced with an exceptional situation and we're still in it. And I think the teachers have done the best they could, and we've helped them too with some material and some, you know, people who are experts in online learning. But we have to really do more into evaluating the quality for the future, because I think online learning will remain in a less quantity, obviously, than now. The major is always learning on campus. That's the most important. But it could be helpful in circumstances where students cannot come on the campus, be it that they're away, far away, or they're ill, or other reasons. And we have to evaluate. So this was all done in an emergency context. And I think the teachers have done the best they could, but we will want to evaluate, and I've been discussing with le Conseil supérieur de l'éducation, and we will do an exercise in evaluating online learning for sure.
I also have a question for Dr. Massé. I'm wondering how you guys in public health, how you weighted the effect that online learning and the isolation is having on students versus the risks of returning to the classroom, because you mentioned that there haven't been that many outbreaks in schools, but you're still suggesting that students only go to campus one day a week. So how are you weighing the physical health risks against the mental health risks?
First, I must say that there's been surveys for mental health issues related with students that done by the Ministry of Education, and it correlates with what we have in terms of public health information, that there has been more issues related with depressive states and drug use, and so we know that that's a significant issue, and we have to break that down. You mentioned very clearly that there's been no outbreaks directly related with classrooms and people that have been directly learning in class. But at the same time, we know that other events are related with that, and the fact that people get into transportation, they meet before and after the courses are all events where we see increased transmission. And in fact, what we've seen during last fall is that there's been a significant increase, not especially in students, but in people aged between 12 and 29, 39. So it's part of the age where people get to college and universities. And we know that's part of the issue. And still now, we do have increased rates in people between 10 and 19 years old. So we are very careful with that. So we have to limit the risk of transmission, especially because now we have variants that we are looking forward that are not very present in Quebec, but still we have identified some variants of COVID that are circulating, so we are very careful with that. So the measures that are taken right now are opening the capacity for people to meet, to see their friends and schoolmates and the teachers, and we'll see what happens with the decrease of transmission in the province. We've seen quite a significant decrease since the beginning of January, and we don't want to play up and down. So that's why we are going very progressively to be sure that what we reopen right now, we won't have to close in a few weeks from now. That's why we ask for all the students to be very careful and respect the measures that are asked.
Merci. Avant de terminer, Madame McCallum, tantôt il y a une petite
Before ending, Ms. McCallan, there was a bit of a confusion. The follow-up question, she wanted to ask a follow-up question, and after that, we'll have ended the press conference.
Merci beaucoup. Yes, the question I had, Minister McCann, is the procedural masks. They're not cheap, especially for a student. Will the government be providing free procedural masks to students and teachers in post-secondary education as they have for the high school and elementary school students?
Yes, the government will provide the mask to every CEGEP and university for the students and for the teacher. It will be provided by the government.
Voilà, ça met fin à la conférence de presse.
And this puts an end to the press conference. Thank you, everyone. Have a good day.